story, I guess, goes back to 2007, where I had a 1-year-old daughter and baby gates. We all love baby gates. And I actually tripped over the baby gate, landed right on my kneecap on the hard floor, and tore my meniscus. A couple months went by, I had surgery with the local guy here and knew nothing of this great and wonderful Dr. Ference at that time. Had surgery, was continued to have problems, ended up with 2 or 3 other surgeries, and then it started on the other leg, and I don't even know what happened to my other leg. Initially, I don't even know what that injury was, but I ended up going through probably, I'd say, 8 or 10 surgeries with this one particular doctor here in town. And it was like, I was almost on what I'm calling the maintenance plan. It was like an 18-month to 24-month maintenance plan. Every year and a half, 2 years, I was going through a clean out surgery. And this doctor comes out of surgery and he says, your knee is messed up, really badly messed up. And he says, you're gonna need at least a partial. 5 months go by. He cons me into doing this partial. Get the partial done. And it was like I started all over again. Nothing but problems after problems after problems after problems. So I ended up going to the local urgent care, where they tried to drain it, couldn't drain it. They ended up opening it up and squeezing all this infection out. And that was on a Saturday. I went back the following day for a recheck. I saw that same surgeon on Tuesday. Wednesday, I was in emergency surgery, where I was left with a gaping hole in my leg so it could close. And I'm talking, this thing was like 1.5 inches wide by 3-4 inches long. It was huge. And I was in the hospital for 6 days. And so, sitting in the hospital, a friend of mine recommended that I talk to Dr. Ference. And I'm going, who's that? I've never heard of this guy. So on his website, he's got this contact me section. So you can go in and, put in your contact information and like a brief what's going on type thing. And I did that. And I thought, yeah, I'll be lucky to hear something. He called me from his personal cell phone the very next day. And I thought, wow, this is not your typical doctor. I mean, most doctors call you, from their office phone, and, oh yeah, only call me, between these hours, and, don't look anywhere else because I'm the God and I'll fix everything. And I thought, oh, this guy's different. I'm gonna call him back. He takes his X-rays and takes me right out to his computer, and he's showing me in details, this is this and this is that and this is wrong, and who did that last surgery? He says, oh my gosh. He's like, your knee is horrible. He says, this guy, who did this? And I could feel the compassion. I could feel the empathy. I wanted to cry. I mean, this doctor, somebody recommended him. I checked him out, and I'm telling you, he changed my life. He really did. He found that my ACL was ruptured when the other doctor did the partial, because he put the partial in the wrong spot. He used the wrong kind of spacer, the polypad spacer that's in there. So my knee was knocking around. And he says, I can't leave you like this. He says, you've got to let me try to fix it. You've got to let me try. He says, I just need to know what kind of spacer they use, what size. You've got a bad history, so let's just get it out, get it done and over with. Nothing but excellence from this guy. This guy's awesome. And just this past summer, I had, after that infection, I had a wound back on my knee. And so I'm trying to be careful doing stuff like taking showers, and I ended up slipping in the shower, and I went opposite knee first into the wall, tearing my other ACL. He looks at the MRI and he goes, "Well, that's interesting." And I said, "I tore my ACL, didn't I?" And he goes, "Yeah." He says, "It just gave up all hope on life and laid right down." And so just this past September, I had another ACL surgery. I had a torn meniscus to go with it. And again, he outstandingly performed this great surgery. I walked out of that surgery room, or recovery room actually, and got a car and went home. No crutches, no brace, no big bulky anything. Just an ace wrap and some bandages. I was just talking to Dr. Ference actually, like just before New Year's, and I told him, I'm like, this, my mom has an issue. My mom ended up having carpal tunnel surgery with them, so I'm bringing him patients now. But we were talking about this lipoma, and at first he's like, "No, I'm not touching that. No, 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 I'm not touching it." Well, now he's seeing that it's growing, and he did an MRI on it just recently, and he says, "That's got to come out." He says, "That's scaring me." He's like, "It's really close to the main blood vessel in your leg." He says, "If we don't get it out of there, you could lose your leg." He says, we got to get it out. We got to get it out." So that's our next plan of action, is to take that out. And I'm not a big religious person, I mean, everybody has their own beliefs, and that's fine. Not many doctors would take the time to pray with a patient before surgery, and he does that. He can tell if you're nervous and need that little extra guidance, and that's what makes him, a human too, you know. And I think it's great that he's got that compassion. He's got a gift. He really does. He's got a gift, and more people should go to him. I mean, he's I've never met a person like him.